All right, so we're here outside of Real Bodies in Las Vegas, and we're gonna get ready to go in and see some real bodies.
Right here, that's the brain, that's the spinal cord, and then this part down here is actually called the cauda equina, because it looks like a horse's tail. So you can see how this is all starting to come apart here, and it looks more like a bunch of hairs, more so than the spinal cord, the solid part of the spinal cord like you see up in here. And this is gonna happen somewhere around L1 or L2 in the low back.
These are the meninges, which cover the brain. And you can see they're not really all that thick, even though they have 3 layers. The outer layer is called the dura mater, which is the toughest layer. But you can see there's all 3 layers there, so they're not really that thick. But that's the meninges that cover the brain.
And if you look at the structure right here, this is the cross-section of the cerebellum. This is the actual cerebellum right there. And as you know, the cerebellum hangs like a bell off the back of the brain. And it's responsible for fine-tuning motor movement. So if we cut that in half, you can actually see we have an area inside. It looks almost like a tree a little bit. And if we look, this area that's in here is going to be the white matter, and there is the arbor vitae. And then it's surrounded by gray matter. These are the auditory ossicles, which are the bones of the middle ear. And you have the incus, stapes, and malleus. And you can see they're pretty small.
Wire mesh put in after a brain tumor has been removed. So they cut out this part of the skull, and then they cover it over with this meshy steel plate.
This is what cancer looks like. This is in the esophagus. So this little black structure right there. This is another cancer, and this is in the rectum. So you can see there's the rectum right there, and this large mass that you see here, that is the cancer. So it's rectal cancer. This is what a normal looking brain looks like. So you can see it's still pretty full. This is an example of a normal brain, and you can see the ventricles that are right in here. So that's on a normal brain. This is what a brain with hydrocephaly looks like. So you see those enlarged areas, the openings, that's because there's fluid in there. So this is looking at the kidney, so that would be the left kidney, that would be the right kidney. Remember, it goes on the side of the person you're looking at. So then you're gonna have these 2 tubes here, and these are called ureters. And the ureters are gonna come all the way down into this substance that the light is on right now, and that's your bladder. So that's the bladder right there. So this right here, this yellowish part, that's gonna be bone. And then when you see this whiter part that's right there, that's actually the disc between the bones. So this is a disc, this is bone, this is a disc, this is bone. This here is the sartorius. This is going to be my rectus femoris, that's right here. This is going to be, this is going to be my vastus lateralis and my vastus medius. These are the trapezius muscles right here, and these are the latissimus muscles right here. This is going to be teri major, and then teri minor is going to be right under there. This is my deltoid muscle that you see over here. So this what you see right here where my shadow is, that's going to be your flexor retinaculum. And passing underneath this is going to be my median nerve. This is the median nerve coming right up like this. And this is the one that causes carpal tunnel syndrome. So when this grows, it puts pressure on this nerve and you get carpal tunnel syndrome. This is looking at the heart. So that one, this right here is going to be a coronary artery. And you can actually see over here just a little bit, another coronary artery right there. This one that comes right off the top, which is, let me see if I can put my finger in there, right there. That's going to be my aorta. And then this one that's right below it, that's right there, is going to be my pulmonary artery, which is bringing blood back to the heart, into the left ventricle. These are healthy lungs and smokers' lungs with lung cancer. This is a fetus at 14 weeks. Anencephaly is when a baby's born without a head. And this is an example right here. Visceral hernia is when they're born with their body parts outside the body. So you can see this is an example right here. This here, right here, is the vas deferens. You can see the vas deferens comes out from a little hole. So what happens is when a doctor is going to do a hernia check, he'll actually put his fingers through the testicle and up into this little hole that you see this vas deferens coming out from, to see if the intestines is pushing against the inside of that hole if there's a tear.
This is a uterine fibroid.
This is a healthy aorta. So you can see the difference in the coloring because the
one that has atherosclerosis is full of plaque. This is an aorta with plaque on it, and you can see the areas where it says plaque right there and down there. So you can see all the areas where you see this kind of like that greasy looking appearance. That's plaque. Normally, right where you see that little brown triangle, that's what the inside of this should look like. These are normal kidneys. Right there, that's a normal kidney with the adrenal gland on top. And then if we look over here, these are what kidney stones look like. All that brown stuff that's in there.
All right, I hope you enjoyed the video, and that was the Real Bodies here at Body World in Las Vegas. And if you liked the video, please hit the like and subscribe button, and we'll catch you next time. Bye.